There are just about 8 working days left now in Albany until they head home for the summertime, and health leaders are concerned that a bill concerning vaccines may be getting left behind.
Well, the bill would end the religious exemption for vaccines at a time when New York leads the nation in measles cases. 2 on Your Side's Emily Lampa talked with Erie County's health commissioner about what she calls a public health crisis.
If they don't pass it this legislative session, what could this mean for New York?
Well,
on the track that we're currently on.
Right. Well, it can mean a continued escalation of the number of measles cases. The number of measles cases, which are growing every week in the United States, is staggering.
So far this year, there are already more than 1,000 confirmed cases of measles in the U.S., 70% of them in New York State. Erie County Health Commissioner Dr. Gail Burstein wants action in Albany.
I mean, it could be now or never.
Her concern is what the growing measles risk will mean for a new school year in the fall. While there have been no confirmed cases in Erie County so far this year, Dr. Burstein worries the busy travel season could dramatically change that.
There's no reason to believe that we're going to escape that.
The bill, which is stuck in the Assembly and Senate health committees, would repeal the religious exemption for vaccines, meaning more children will have to get immunized to attend public school or licensed daycare facilities because the only exemptions granted will be for medical reasons. With just about 8 session days left in Albany, Governor Andrew Cuomo said on the radio this morning that the bill has to pass, but he admits the likelihood is 50-50.
If it doesn't happen, I think we put this state's public health at risk. I respect the religious exemption. I hear the anti-vaxxers, but public health comes first.
Dr. Burstein admits she reached out to Assemblyman Robin Schimminger, who sits on the health committee. She hopes if the science doesn't move the bill out of committee, the costs will.
The costs are tremendous. So far, New York City, as of last week, the health commissioner reported that so far they spent $2.3 million on their measles outbreak, and that's just in New York City.
And we also reached out to Assemblyman Schimminger to find out where he stands on the legislation and to see if the bill is on the Health Committee's agenda for discussion. Since he is in Albany, we requested a phone interview on this subject. We're still waiting to hear back from him. Emily Lampa, Channel 2 News.